pharmacists, lab scientists, physiotherapists, all of us coming under the same umbrella is part of the inherited Cold War that had always been existing in the health sector between the various professional groups, so to say. So coming together to diffuse sectarian interest, for example, is a challenge. Doctors will not start suspecting pharmacists, pharmacists will start suspecting nurses, and you say coming under one umbrella. But we are all advocating health insurance, because without health insurance, out-of-pocket payments by users of healthcare will be a difficult thing to achieve, because the cost of healthcare delivery is skyrocketing. And the only way we can contain it and then make it available, accessible, acceptable, and I would say something that is financially reasonably pocket-friendly will be through health insurance. And so making the various members of the team coming to understand and accept one another and embrace one another without suspicion is a very great challenge for us. But then we are negotiating with National Health Insurance Group, we are negotiating with the HMOs, we are working with other stakeholders to make sure we all work together. But then we are making sure we want to make Nigerians understand the principles and practice of health insurance.
Okay, let me ask Dr. Chukwu, if we're to say that we've got limited time and we've got to find solutions that would endure, that would work for this nation, what are the things that you think we should attack first? Is it the training and the education of people in the healthcare, or the training of those who are training them, the lecturers and the trainers and so on? Or is it more a case of finding the infrastructure that would make it possible for us to deliver world-class quality healthcare service?
Oh, you're right. I would say all. All.
But we don't have money for all of that.
Where do we start from?
We share what we have, because the quality of people coming into medical school is very important. You must have a passion for medicine. I've talked to medical students who are just like a desical, and they say, look, truly, Oga, I'm not really interested in this thing. It's my mother that is pushing me. So the people who come into medical school ideally should have passion for medicine. They want to learn medicine, not because somebody is pushing them. And I think that goes for all professions. It's demanding. So it's not something that somebody should push you. Good. Now, the leaders, that is the trainers, they too should have passion for what they do. If you are there because, well, I think I should be in America, but somehow I'm not in America, I'm here in Nigeria biding my time, I want to go as soon as I can, you're not going to put in your best, and it will reflect on who you are training. So the trainers too. Of course, if the infrastructure is not there, there's no water, there's no power, you have the teachers, you have the students, but the infrastructure is just not there. So we have to share whatever we have and move equally. We can't, if you take one whole and you take it into parts, it is the parts that make the whole. If one part is not working well, the whole will not work well. So we need to bring up all those areas you mentioned. Okay,
Dr. Arugbabu, so if we're to follow the strategy that Dr. Chukwu is putting in place and say the students, we've got to maybe have career developers or career consultants who would talk people through the process of choosing to go to medical school or choosing to be a nurse or choosing to be a midwife and all that. And then we look at the trainers and we look at the infrastructure. Where do we begin to find the budget to make it happen?
Yes, thank you. I think the most important thing is that the issue of health should not be politicized. Any nation that is trying to politicize it, especially in a multifaceted ministerial system, will soon find itself in some level of challenges. Health is wealth. If you're not in good health, you can't even fly an aeroplane. Even you see food to eat, if you're not in good health, you cannot eat it. Until we begin to realize the fact that when we are healthy, it's only that we can sit down and plan very well as a people. So it's not a matter of coming to competitiveness and begin to say, look, why should you give so much to health? What are you now doing to this sector? What are we doing to that sector? And I think, having said that again, our curriculum, for example, we need to review our curriculum. we need to begin to insert certain new ideas into the medical curriculum.
Right.
For example, I mean, managed care, for example. Like I mentioned on health insurance before, we need to introduce something like that. Management itself, about management. Doctors were not principally trained to be business managers. We should begin to think about something along that direction. And again, outside of that, we begin to also develop political will. The political will is not there to say, look, we take health on its own priority and begin to think of how to make Nigeria a tourist center where people can come in instead of us going out. Empower even medical and dental consultants group, empower the Nigerian Medical Association as it were, and they also knowing their responsibilities, sitting down, planning with government and various stakeholders, and we all begin to tell ourselves that the health system of this country, if it were in shambles, how can we move on? Where have we gotten it wrong? Identifying them means now we would say that more money should be budgeted, and the budgetary allocation should also be monitored for proper performance.
Let me quickly come in here because we need to round up. The issue of cancer is becoming more rampant all over the world, and now it's becoming even more popular in the country. We're losing more people to this. Are we ready to battle that disease?
It is not. Yeah, it is not actually a difficult thing as a people. If we begin now to see, just like you mentioned, the prevalence or the incidence of cancer coming up, our environment is very important. Pollution is all over the place. Irritants are all over the place. Waste products, the way we dispose of our waste, chemical products, which we call carcinogenic materials. What's our attitude to all of this? Even the materials that come in, we use, like pomade and other cosmetology that we do, whatever we do to shine up and clean the skin and other things, what do we do? Our attitude in preventive medicine, for example, screening exercise, for example, to screen maybe the breast, maybe to screen the private part or whatever, as an annual requirement, for example. It's a pulmonologist, for example. How many of our people do come in to just say, you want to do lung function test, you want to see how your lungs are performing and other things? These preventive measures, if we introduce them, we can reduce the incidence of cancer as much as possible.
In terms of treatment being available for cancer, are we there yet?
We have something, but maybe not as good as it should be. That's the area we call radiotherapy. The machines are very expensive to procure. It's quite expensive for anybody to pay, and it's not as widely available as it should be for a country of 170 million people.
Okay, so if that is the case, where is the investment going to come from?
Very good question. Like he was saying, we were taught to qualify as doctors, go get a job. But the emphasis should move. You learn to be a doctor, to be an engineer, whatever. You also learn entrepreneurship somewhere along the line so that you create job rather than looking. This is how your question will be answered. When you now have people who have the know-how and they have the entrepreneurial ability to set these things up, then it becomes easier. Government cannot do anything, and nowhere in the world does government do everything. Medical tourism, Nigerians are going, most of them go to private. They don't go to the public institutions where they go to. I know Apollo Hospital in India, that's where most Nigerians go. It's all privately owned. And they have so moved that they're even training. I have a young doctor who is in Apollo Hospital somewhere in India to train as a private establishment.
Okay, well, we have to close now. Your final word, and can you put that focus on the issue of private sector in terms of private hospitals? Do we have enough, and are they doing well?
Yes, what we are trying to do right now is to encourage group medical practice, and also working along the same climax to see if we can join the train of mega hospital establishment. And by the time we are able to do this, we'll reduce overhead costs, we'll attract more patronage, and the various specialists and specialties, for example, will be able to work in a coherent manner. Family medicine is the hinting, and primary health care is most important. If we get it up at the primary level, our challenges at secondary and tertiary will be highly reduced.
So what time, is this something, an agenda being pushed by the organization?
Honestly speaking, it's a short-term project as far as that one is concerned. We are already working on it. We have committees that are looking into that, both at the Association of General Private Medical Practitioners of Nigeria, which is a GPMPN, and as well as the Healthcare Providers Association of Nigeria. We are working in synergy.
Okay, thank you very much. Dr. Chukwu, your final word?
Doctors should have passion for their job, commitment for their job. If you got into medicine and you discover, oh, I'm in the wrong place, go do something else, because it takes quite a lot. You are called at 2 a.m., you are called at 4 a.m., you are called on Christmas Day, you are called on New Year Day. If you are not that kind of person, go do something else.
Okay, thank you very much, Dr. Cyril Chukwu, Consultant Pulmonologist at the Lagos University Teaching Hospital, and thank you, Dr. Adeye Arigbabuwo, Deputy National President, Healthcare Providers Association of Nigeria. Thank you very much, sir. We're most grateful that you've shared your time. Sunrise is just about to get into
we are excited.
the home stretch. So we'll take a short break. When we come back, it will be